Once I was exposed to midwifery, I just knew it was the role that I wanted to take on. And I don't want to take away from being an L&D nurse, because I know that's a great calling to have. But for me, I just knew midwifery was what I wanted to do, and it is a separate role from L&D nursing. And so once I kind of experienced both, I knew I wanted to take the route of becoming a midwife. Before I came to U of M, I would always try to search for like midwifery-based research, and I'd like half the time see the U of M logo on it, which was another reason why I wanted to come here. And then the names of the researchers who did it are my professors, which is something that's been almost surreal to kind of come to the root of the most evidence-based research and find out that it's the people who are going to teach you the basic skills of midwifery. So I think just being so close to them has been incredibly beneficial to me as a student, to kind of find that confidence that this is the most like up-to-date research that I can be learning to provide for my patients. I would ask about the size of the classes that they take, like how many students are in the program. For me, finding a school that had a smaller like professor to student ratio was important for my learning. I would ask about cost, because that's always going to be a big issue. Whether or not you can have a job is another large part of the program. Obviously, funding school can be a big issue for people, and I think focusing as much as you can, cutting back on work is going to be the best option for your learning, but that's always a question that I would ask, is how much work time you can have during the program. I'd say to get as much exposure to birth as you can before coming to midwifery school. I did that through an internship. I came directly from my bachelor's degree program, so I'm a little unique in that I don't actually have L&D RN experience, but I think just learning that everybody has a skill set to bring kind of to being a midwife, and that each of those skill sets are valuable. So kind of utilizing whatever you have to bring to the table to make you a better midwife. I chose to come to the University of Michigan not only for the reputation of the midwifery program, but also for the global health opportunities that they offer. Actually, I will be going to Uganda for 4 weeks, the kind of obstetrical care there to learn from them, but also in some of the refugee camps in the area. So I think it'll be invaluable in my experiences with patients of different cultures. Of course, there's no way to be 100% fully culturally competent, but the more exposure that we can get, especially in kind of the safety net of being a student, I think can only be beneficial for my practice as a midwife. So I kind of decided U of M, like first for the reputation. I really wanted to come to be the best midwife. I wanted to come to the best school possible. But two, the fact that U of M finds your preceptors for you, I think is invaluable. U of M is unique in that way. I'm part of the American College of Nurse-Midwives student program, and I see posts all the time of students looking for preceptors, willing to drive 4 hours to a site just to find someone to teach them. And I think U of M, in finding ours for us, saves so much time. So obviously as a midwife, the birth part is probably going to be my biggest highlight, just kind of getting exposure to that in a sense that you don't get even from being an RN, from really doing anything else. It's such a unique experience to be kind of in the safety of a student while also having the role as a provider. And I think U of M does a good balance of that, of independence and support, especially through them finding the clinical sites for us and even like informing the preceptors of the kind of teaching styles that they want us to kind of have throughout the program.